Here in Hamilton, St. Joseph's Healthcare is apologizing to a family after discharging a patient less than 24 hours after they attempted to take their own life, only for them to go home and try again. Roger Collins reports.
I think it was like 12:40 on my lunch break. I called again and they said she was going to be transported to a center for people in crisis. So I thought, okay, she's in good hands, you know, she's going to be looked after. Everything was fine.
Jake Witts was at work the day after his fiancé attempted suicide, periodically calling St. Joseph's Hospital in Hamilton to check on her condition.
At around approximately 2 p.m., she texted me and said she was being discharged, given a taxi voucher, and she would be sent home. So I immediately called the hospital, and they basically told me, oh, she's not in our care anymore. We can't divulge any information regarding her or her discharge.
Fearing the worst, he rushed home.
When I got home, she was already on the couch. There was a bottle of pills tipped over, and she'd done the same thing again, like immediately after being discharged.
For the second time in less than 24 hours, Witts was on the phone with 911, desperate to save his partner's life.
Definitely traumatic.
Witts says the hospital's decision to discharge her has left him disillusioned with the healthcare system.
She could have died, for sure. She could have suffered permanent brain damage. She could have got in a vehicle and drove, and she could have hurt herself or somebody else.
In a statement to CHCH, the hospital's vice president of mental health and addiction says it has apologized to the patient and her family, and adds that it is working with this patient and her loved ones to understand what happened and identify any opportunities for improvement. Before going on to say, it will undertake a case review and implement any changes that are required to ensure the safety of its patients.
She described the way that they discharged her as they were kicking her out.
Emily Dakers, the director of the Good Shepherd in Hamilton, works closely with St. Joe's as a short-term stay-home for those who have been recently discharged. She explains what can happen.
A lot of the folks that come to stay with us have been put through a Form 1 process. That means that they would be taken to hospital, they would be assessed by psychiatry, and then referred to us and released to us. We receive a referral from St. Joe's. Our frontline team speaks to that person directly. So we are a very person-centered program here, and so it's always going to be about what is this individual's goals, what are the things that they want to work on. The person that's staying with us or is referred to us wants us to connect with family or friends or whatever that might be. We can support with that conversation. Having conversations about your mental health with your family or friends can be really difficult. So we can help to facilitate that if that's requested of us.
Roger Collins, CHCH News, Hamilton.